Line 39. When in greater yang winds strike the pulses floating and tight, and there is fever, aversion to cold, generalized pain, absence of sweating, and vexation and agitation, major green-blue dragon decoction, de qing long tang, governs. If the pulse is faint and weakened, there is sweating and aversion to wind, the person cannot take this formula. If takes it will be frigid extremities, jerking sinews and twitching muscle, indicating an adverse treatment. Ephedra, ma huang ephedri herba, 6 liang, remove nodes. Cinnamon twig, guiji, Cinnamomi ramulus, 2 liang, remove bark. Mix fried licorice, 1 tan gong chao, Glycyrrhizae radix, 2 liang. Apricot kernel, Shing armeniaceamen, 40 pieces, remove skin and tip. Fresh ginger, Shang, Zingiberus rhizoma recens, 3 liang, cut. Jujube, Dezeo, Sitsifructus, 10 pieces, broken. Gypsum, Shirgao, gypsum, a piece the size of a chicken's egg, crushed. For the above 7 ingredients use 9 shang of water. First boil ephedra, ma huan, to reduce the water by 2 shang. Remove the foam, collecting on top and add all the ingredients. Boil to get 3 shang, remove the dregs, and warm take 1 shang. Obtain mild sweating. If there is copious sweating, apply warm rice powder. As soon as there is sweating, stop taking the decoction. If the formula is taken again, there will be copious sweating, cause yang collapse, there will be aversion to wind, vexation and agitation, and inability to sleep. Line 39 discuss the signs and treatment of greater yang cold damage with interior heat. Emphasize the contraindications for the use of major green-blue dragon decoction, de qing long tang. In this line, the use of major green-blue dragon decoction, de qing long tang, is suggestive of cold damage because a large amount of ephedra, ma huan, is used. Professor Zhou-da said in this line that wind strike is a mutual word for cold damage. When the exterior is bundled by wind cold, no outward pathway exists for the interior heat. Also depressed the yang will turn to heat. Consequently, vexation and agitation arise. So promote sweating will resolve the major symptoms. Both the exterior cold and the interior heat are excess patterns. Major green-blue dragon decoction, de qing long tang, contains ephedra decoction, ma huang tang, in order to resolve the exterior. Fresh ginger, Shang, is added and, in combination with cinnamon twig, guiji, and a large dose of ephedra, ma huang, promotes sweating and dispels cold. Gypsum, Shirgao, sweet, acrid, very cold, can help ma huang relive the muscle, unblock the depressed yang, also clears interior heat, drains fire, and eliminates vexation. Mix fried licorice, gong chao, and jujube, dezao, are added to harmonize and protect the center and the fluids. This is a strong formula for the promotion of sweating, yet Zhang Zhongjing writes that mild sweating should be obtained. After mild sweating, should stop take the formula. Furthermore, if copious sweat issues, apply warm rice powder to the exterior of the body to stop sweating. In the second part of the line, the pulse is weak and faint, and has sweat, aversion to wind, are observed, which means that both the interior and exterior are deficiency. In this condition, major green-blue dragon decoction, de qing long tang, must not be given. If take the formula in this case, the loss of sweat causes yang collapse and yin diminished. The yang qi is unable to reach the limbs, giving rise to frigid extremities. Also yin fluid cannot nourish the muscle and sinews, the condition becomes worse. There is a case, on a summer hot day, a young man had heavily sweat, then he went down a well. It was cold as ice at the bottom of the well. Immediately, the sweating disappeared all over the body, and then he has body pain, aversion to cold, no sweat, irritability. Take other formula, are not effective. The doctor saw the patient was red-faced with rough breathing and his pulse was tight and floating rapid, then discussed with other doctors, gave the patient major green-blue dragon decoction, de qing long tang. After 1 dose, patient got recovery. Synopsis of the golden chamber used de qing long decoction for overflowing fluid retention. Fluid and water flow to the 4 limbs, when should sweating but patient cannot sweat, generalized pain and heaviness, this is spillage room. The de qing long decoction was mainly used for the function of promoting sweat to relieve water toxin, water evil in the extremities and under the skin. Professor Zhou-da had treated an overweight patient, his hands were swelling, sore, heaviness, before patient took formula that tonify qi and drainage the water, like Huang Qi Fang Ji decoction, also injection of vitamin B1, B12, have no effect. Professor Liu used de qing long decoction, and spleen effusing decoction, UB decoction, the patient recovered after sweating.